3.
Okay, before entering the room, I'll review the patient's chart for any significant findings. Yes, the patient has, I verified the patient's order for ABG from the doctor. I'm looking for any type of significant blood thinners or anticoagulants. That being said, I would gather my equipment. I would get my ABG kit, a towel, and gloves. So now before entering, I wash my hand, put my gloves on. I go into the room. I introduce myself. Hi, I'm John, respiratory care student. I'm here to draw some blood from you. Before doing so, I have to check your ID. I check the patient's ID. Yes, I verified the patient by name and date of birth. Okay. I have my kit and my towel. Now, before doing anything, I would check to see if there's any type of oxygen treatment, or I would check those. Also, I would check the vet settings for my labeling. So now I'm gonna have the patient. I'm gonna do a modified Allen's test and check for collateral circulation. I'm gonna have the patient put his arm up, make a fist, and I'm gonna compress both arteries, the radial and the ulnar, okay? And now at this point, I'm gonna have the patient open his fist up, and I'm gonna release the ulnar artery to see any type of collateral circulation. I will do this within 10 seconds. Now I'm gonna place the towel underneath the patient's arm or wrist to extend it. Now, I go ahead and palpate the pulse. There's a pulse, a strong pulse. Now I'm gonna have the patient get my kit equipment ready. I have my syringe, label, alcohol swipe, Band-Aid, and my bag and my gauze. Get everything ready here. Now I'm gonna clean the area for 30 seconds. Circular motion, like so. Those are my fingertips. Make sure my belly's up. I draw back from 0.5 to 1 cc's. I fill in my label, patient's name, the time, room number, temperature, what I got off the chart, doctor's name off the chart, the date, FiO2, patient's on 4 liters for 36% FiO2. I repalpate, feel a strong pulse. I clean the area, I clean my fingertips. I'm gonna instruct the patient that he's gonna feel a pinch, bellows up. All right, I got my palm holding down at 45-degree angle. If I don't get a flash of blood, I can redirect, but not taking the needle out. All right, I got a flash of blood. Okay. Now, I cap the needle. I'm gonna hold on to the puncture site for 3 to 5 minutes. If the patient's on any type of anticoagulant, I will hold it for 10 minutes. Okay, it's been 5 minutes already. So I'm gonna go ahead and put my Band-Aid on my patient. Okay. I'm gonna roll my syringe so the heparin could do its thing and not causing any type of clotting. I cap it, take the excess air bubbles out of it. I put my label on the syringe, open my bag up, put it in my bag. I will clean up my mess. So now what I'm gonna go ahead and do is I'm gonna reassess the patient, make sure everything is all right with the patient. I'm gonna go ahead, now if it's longer than 30 minutes, I'm gonna put it on ice. If it's 60 minutes, the sample's no longer good. So now I'm gonna take this, bring it down to the lab, chart the patient, put notations in the patient's chart, and that would be it.